Good morning, Dr. Pearlman here. I'm actually very likely going to run out of battery. I really hope not during this recording. I'm going to try to make this quick. You know, I don't often get on here and ever want to brag about either something I do in the clinic or that my wife does in her practice, or we do, whether we're, collaborating to help people. But she told me a story yesterday that, I'm not surprised, but I think some of you out there who don't spend as much time in healthcare as I do or she does may appreciate this. 50-some-year-old man who has a family, he's a father of children, and his wife come in, and they had been a new patient of Jen. And what was interesting was they weren't there for the husband, him. They were there for her to get her routine checkups. And they asked, hey, he's having a lot of, not necessarily memory issues, but he's so talkative all the time. He's such a talkative, upbeat, uplifting person. He's carrying the conversations, and he's having trouble finding his words. And so Jen hears, what they're talking about, and, when she listens more and more to the thoroughness of their presentation and how much they were worried about him, she quickly gets him in for an intake, notices some things, and kind of talks to him about early onset dementia and various other possible diagnoses, but says, what have you been doing for it? Strangely, they had been to a primary care medical doctor who somehow didn't order an MRI of the brain, and somehow they ended up on their own alternative route to a functional medicine provider. I actually know who this particular person is. And they, after an evaluation, decided to tell them that it was a vitamin deficiency, prescribed them vitamins, lots and lots of vitamins. I happen to know, again, this person is very much, they'll have you pee in a cup, take it home and freeze it to send to the laboratories that's not valid under any circumstance. They'll take blood in their office and then have you go home and freeze the blood and ship it to another type of laboratory for third-party testing or whatever, and give them multiples vitamins. Jen orders an MRI for this person, and it comes back very, aggressive glioblastoma, made from glial cells in the brain. It's one of the most aggressive form, if not the most aggressive, malignant type of tumor, very hard to operate on. And, it's funny because he didn't have any headaches. He didn't have too many, weakness or other types of symptoms to go along with, typical brain tumors. But he did have a lot of difficulty finding his words, And one MRI order overnight got him the diagnosis. Now, you can get into all these other weird conversations about whether or not, is it better to know or not know, and what does this mean for their future, and now the family's shattered, rather than just saying there's something wrong with my dad. I mean, they have answers as to what is wrong with their dad, what is wrong with her husband. He gets to now say, this is what's wrong with me. I'm not just losing my mind. And in closing, because I just want to get out of here really quick, and obviously kudos to Jen, and this is the way that I practice, if you know me, which is I don't care if the standard protocol is conservative care before imaging, because your insurance or most insurance providers won't reimburse for it. That's ridiculous. You can get cash brain MRIs for $300, $350, $400 is about the peak cap. With contrast, it might be closer to $500. But again, this should not stop anybody from getting diagnostic imaging and real diagnostic blood work. If you go to a doctor and they send you out to a place like LabCorp, if they send you to Quest, any lab tests now, some of these other big, phlebotomy, so to speak, blood drawing companies, that is real blood work where you get it analyzed, the place that they draw, they're not shipping out, and it's certainly not some third party, $500 testing kit to test for, mercury and B12 and this, that, and the other thing that they can do at all the places I just mentioned. Okay, we don't have to overcomplicate, genome, testing when you're not with a specialist in a hospital setting. Just like if they don't right away for something that is like cognitive decline, order a brain MRI, it's complete negligence. Now, again, insurance is another topic, but you as the people who want your answers, you're there, you better start demanding your answers. And your answers you're demanding might mean you pay a little bit of money, but you certainly have to be your own advocate and get these advanced scans. So It's just it's a really serious story that people need to hear within healthcare, how to like be your own advocate. Don't let people bleed you for, thousands of dollars for vitamins and supplements that don't work anyways 99% of the time. I mean, if I could list 4 supplements on my hand that I think probably just do really well for most people when it's not condition sensitive for like one supplement, it would be something like fish oil, magnesium, vitamin D, and oh God, could I even pick another one off the top of my head that's just not like popping in? Oh, don't forget my words, I'm losing my way. But no, like seriously, brands of magnesium, fish oil, vitamin D, you know, maybe berberine, is something we could talk about when it comes to lowering blood glucose or being insulin sensitive. So those types of supplements is like, typically what I would, tell people. You could probably take these and get a benefit, certainly not going to have any harm. Whereas, I could say things like, having B complex vitamins could probably be harmful to the kidneys. I could say excess vitamin C is probably harmful to the kidneys. I could go on and on and on about all the other supplements that are probably actually, probably hurting your liver if you're taking them too consistently. Adding to calcium if you take calcium. See, I didn't want to go down that road, but this is how excited I get. There's a lot more efficacious things you could do than be loaded up on a bunch of supplements for vitamin deficiencies. And you've got to have the real blood work that you get at a real place like Quest, like LabCorp. You've got to go to these types of like real places through the hospital, through the medical doctor, and or through the providers that send you direct to the source where there are trained phlebotomists where they read it for you and you get the results. And you've got to go to imaging centers to get the necessary radiology that will give you the probable diagnostic or absence of feared diagnostic. And you just got to do it, because otherwise you're never going to know. And you're going to be just out there guessing, anxious, sympathetically driven, high cortisol, and all the other bad things that happen to your health when you are constantly worried and you're fearful, and people are possibly doctors, your family members, your friends, telling you you're crazy and it's not that bad or what's wrong with you. This is all very serious stuff. So please take your health serious. Please be your own advocates, and please don't let anybody just milk you along without necessary imaging and proper blood work at the very, very, very least. All right, thank you guys. Until next time, this is Dr. Pearlman.